Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello, everyone. This is Christopher Cunny, and welcome back to another episode of Straight Outta Health IT. I'm so excited again to have on this show two amazing guests that hopefully will have a very interesting and enlightening conversation today. And a lot of this spawned from just, quite honestly, my personal experience as a recovering CIO and the experience I had in managing IT operations for healthcare systems across the country and the relationships that I had working with my vendor/strategic partners. And so the topic of the day is and I've also been on the vendor side too. And so the topic of the day is really, how do you transition vendors to strategic partners? And how can hospital CIOs really maximize those technology investments that they make through these partnerships? So in today's healthcare industry, technology plays such a vital role in managing patient care and hospital operations. And as a result, it's essential for the CIO to not only select the right technology vendors, but also cultivate strategic relationships and strategic partnerships with them. As the technology continues to evolve, the CIO must be able to maximize their investments in order to provide the best care to the patients while staying within budget. On this episode of Straight Outta Health IT, we're going to talk about that whole relationship, the whole ecosystem, and the steps CIOs and vendors can take to start moving from transactional relationships to one that's really value-added strategic partnerships that will enable them to make the most out of those technology investments. And really, by establishing strong relationships with those technology partners, CIOs can create a culture of innovation within the hospital and ultimately achieve better outcomes, which is what the mission of healthcare is all about. So today, I got on the program, again, two amazing guests, and thank them so much for taking time out of their busy schedules to join me. The first person I'll introduce is Ricky Fletcher. Ricky is the Director of Strategic Partnerships for Luma Health. Let me share just a little bit of Ricky's background. With 7 years of enterprise healthcare IT sales, an additional 5 years of specializing in enterprise health IT, SaaS, sales, and business development, Ricky brings a wealth of experience to the table. His current role at Luma involves leading business development and partnerships, where he's effectively utilized his network to collaborate with some of the nation's leading healthcare systems. And also on the show is Scott Raymond. Scott serves as Vice President and Chief Information and Innovation Officer for Nebraska Medicine. In his dual role, Scott oversees information technology and innovation. He leads enterprise change, enable customer-facing digital technologies, provide big picture plans and strategies that implement complex customer, clinical, and technical initiatives. These are just a few of his core strengths, and with over 27 years of healthcare experience, ranging from hands-on critical care to strategic operations, Scott possesses a wealth of experience and ability to understand how healthcare technologies impact patient care and enables the culture to achieve greatness. So, gentlemen, thank you for so much for taking time out your busy schedules to join me today. And let's get started. And always, when I like to start the program, what I like to do, I gave you a very brief background of these two gentlemen's roles and experiences, but that doesn't really tell their story, their journey. So I like to have each of them spend about 2 or 3 minutes just talking about your journey into the roles you're in today. And we'll first of all start with you, Scott. Let's start with you, and you tell us a little bit about your journey to the role of CIO.
Yeah, sure. Thanks, Kenny. Christopher. That bio you read is the slick marketing spiel that you put out. So I've been in healthcare for 27 years, or actually a little over. I started out as a pediatric ICU nurse and never really intended to be. And I was working in a real advanced critical care unit for children and was happy in that role. But as things evolve, I was asked to become a manager of a big pediatric unit. And then that kind of leads to the next step. And they asked me to actually try to help shepherd physicians through the Epic journey. Exactly. At a health system, I worked at Southern California, We actually signed our contract late 2004, early 2005. So that'll give you some perspective of how long ago that was.
Process,
one of the early adopters.
Exactly.
And we thought it was really important to have clinicians that had deep physician relationships to be part of a team that helped the physicians adopt the EHR.
Absolutely. They have to.
Yeah. And I think we did a really good job. And I think even Epic really applauded our efforts. And those efforts continued after I left. So I joined the team. I had a group of physicians, a pharmaceutical detailer. So I had a group of physicians responsible for, and I helped them anywhere from email to accessing the current clinical systems. And after our first go live, I took over that team as director of physician informatics, which is interesting having a nurse and not a physician in charge of informatics for physicians. But we had a really well-oiled team, and we did 6 implementations, about 1 a year, until we got all of our hospitals up and live. And then we would leave folks behind at each campus to support ongoing functions. And it led to what I call proper IT when our last install, the site CIO went to another facility.
Sure.
And the COO, he got out at the right time, because you know how getting a campus ready for an Epic implementation. The COO, who had all the CEOs of each hospital reporting to her, was a nurse and a mentor. And she said, "Hey, you're going to be on campus anyway. Can you do the IT part?" And I'm like, "Sure." So I took over IT and did my other job as well. And we implemented Epic. And then I just stayed, like we were done implementing. And then I stayed as site CIO, went on to be
the IT bug.
Yeah, I did. And it was fun. And then I went on, I got promoted to executive director of technology and innovation for the system. And part of that role, I got connected to our for-profit innovation arm.
Sure.
And so I was the main operations and clinical counsel for the investment arm. So it was about a $40 million fund, and we would invest in companies. And our tenet was to look for solutions for problems we had and not the other way around. So not innovation for innovation's sake. And so I did that and did my other role and introduced a lot of new technology, did all the pilots. And then my crown jewel at that organization is I built an innovation center where we had a data center that could support a 2,000 bed hospital. We had an instance of Epic we could test against in our lab. And then we had open space that we could convert to a patient room or an OR space or even a nursing station.
Exactly. You guys were on the front.
It was a real
early 2000s. Who was talking about innovation? And not only that, but building an innovation center.
Yeah, and there wasn't a lot. And then, of course, Peter Sinai and New York Presbyterian, they started going down that route too. And we actually joined forces with Cedars and combined our innovation and created Summation Health Ventures. And we did that for a few years before we had a nice breakup, a friends breakup, and we both went our separate ways. So then an opportunity came up in Colorado to be the vice president and associate CIO of a big health system in Colorado. And I took that opportunity. I left my job of 20 years at Memorial Care and went on. And I had a team, all operations reported to me. And again, kept with that mission of being innovative and try to platformize, or we coined the phrase platformization to leverage the platforms that we had. And so that stint ended. And I went, like you, I went to the vendor side for a while and really enjoyed that. But an opportunity here in Nebraska came up for a CIO, which, Christopher, once you get in that IT thing, you either set your sights on the end game or you just So this opportunity came up here and I couldn't give it up. It's my dream job and working for an academic medical center and really enjoying that side of it. Lots of challenges when you combine academia and a health system.
Absolutely.
So that's what I've been doing for the last 15 months.
That's great. Congratulations on the role. Congratulations on your journey to the CIO role. And I'm sure having been on the vendor side, you got that perspective as well too, that I'm sure you'll discuss as a part of this conversation today. I want Ricky to jump in here now and share a little bit of his journey as well in his role as a technology leader, advisor, partner for health systems.
Yeah, I wish I would have went second because I don't know how, or I wish I would have went first because I don't know how I'm going to follow that up.
Wow.
Yes. I started my career in financial planning, which when you're 22, 23, it's the worst career choice because no one is ever going to listen to you. But that was right around the time, like the Meaningful Use Act and the Epic implementation were just flowing. And Nashville, I live in Nashville, and it's a health tech metropolis based off HCA and CHS and Life Points and others.
Exactly.
Yeah. So they had a lot of firms, and I got with one that was staffing Epic implementations. So I did that for a while, but I did want to go to the technology side. So I had left there and worked for a legacy data archival vendor. It was actually covering, I got chosen to cover Colorado, and I knew one person in Colorado and just so happened he was friends with Scott. So I went there for the HIMSS meeting and started to meet everyone in Colorado. Great group of people. And at that point, I was like, I wish I could cover Colorado permanently and be in business development. I met Scott. Scott took me up on a ski hill and he left me.
It's a great way to build a relationship.
Yeah, it's a great way to build a relationship. I was trying to close.
Yeah, give him a black diamond, right?
Yes. And that was my first time skiing. And I think I got a text from him and another friend who I worked with. And it was like, hey, man, just meet us at the bottom. So I fell literally all the way to the bottom. Luckily, I did not get injured. But actually, coming from like a HIMSS conference, listening to Scott talk, the points he was making is our Epic system has over 5 million unique patients, and the state of Colorado only has 5 million, and we're not the most profitable at that time health was. Okay, I think Centura had more facilities. Scott's thing was like, hey, we're not doing a great job of retaining patients and keeping them within our four walls. So that's made me think, I think my next role should be with engagement arena. And then I joined Luma about 3 years ago now. And since then, it's been working with strategic partners, whether it's health systems or other vendors to collaborate and solve any issues with patient engagement and fill in any gaps as far as patient communications.
That's wonderful. I'm glad you shared that story about Scott saying, here's my problem, here's my challenge. And now I'm looking to a partner to help me solve this problem. And I want to delve into that later in our discussion as well, too. It goes without saying that technology is advancing every day. It has transformed the healthcare industry in many ways, and hospitals and healthcare institutions are investing more and more to improve patient outcomes and streamline processes and reduce costs. Obviously, the COVID pandemic has now forced them to double down even more on technologies that provide both virtual and acute care in a number of different innovative ways today. And so the role of the CIO is crucial in helping to maximize those technology investments, as well as identifying the right solutions for the hospital to meet those growing needs and their business objectives. And this involves this type of relationship, identifying vendor partners you can trust, to evaluate the right types of solutions to help me solve problems. Obviously, technology doesn't solve every problem, but can it help enable the resolution of problems or enable us to meet our strategic objectives? And I'm looking for organizations and individuals in particular that I can trust to help navigate me through that process. So that being said, the very first question I want to ask both of you, and I'll start again, Scott, with you, is understanding that relationship with the vendor. Why do you think it's so important in this rapidly evolving landscape that it's imperative for CIOs to cultivate strategic relationships with key vendor partners?
Yeah, I think for me, and I really put this tenet in place for me, even when I was a bedside nurse, you really have to form relationships. Those relationships go both ways. You have to be able to rely on. So if I'm the nurse working in the ICU, I rely on the attending physician. I rely on my respiratory therapist, and you really can't do your job without that trust and that relationship. And as you're a former CIO, every vendor will call you, every vendor will knock on your door.
Right.
They'll bring you lunch. They'll want to sell you something, and they'll want to sell you a solution, whether you have a problem or not. And I think I've always tried to cultivate the relationship because Ricky has been in 2 different companies that I've dealt with him. It carried over. He's someone I can trust. He's someone that I know is going to add value, and he's going to be there for me, and I'm going to be there for him. And that's how it has to work. And I know that seems more social from a business perspective, but I don't think so. I tell vendors when they come, I want a relationship and I want to see the value of my contract. If I call you, I want you to answer the phone.
Exactly.
And I want you to be part of the success here. If you can't show me how you can add to the success of my organization post sale and try to optimize whatever environment that I've implemented with you, then you're not a partner to me.
That's right.
And I had to do this, and I'm sure you've had discussions with others. During COVID, I actually had to call my vendors and ask for delay of payment or discounts of payment.
That's right.
And guess who are the ones that followed through and gave me a discount or deferred payments for a period of time so we could get through?
Right.
It was my vendor partners, and it was the relationships that I think I built that allowed me to do that. And without that, I think regardless of the sale amount,
exactly.
those folks would have said sorry. And
that's right.
And some of them did. And big companies that you wouldn't expect actually said, sorry, we can't do anything for you.
Yeah. And that's unfortunate. It's funny you talked about it from that context as well. I know, to your point, when I was sitting in that chair as well, and I, like you, would get called on by a lot of vendors as well. One of the first things I would ask them, especially those who weren't traditional healthcare vendors, I said, first of all, are you prepared to be in healthcare? Are you prepared to own the responsibility of saving people's lives? Because that's what we're using your technology for. And so I want you to say that you're prepared to stand beside that clinician when they walk in that waiting room and they provide an update to those loved ones about their situation, and they use your technology, good, bad, or ugly of the outcome. You're going to stand right beside them as this technology helps save their life, or unfortunately, the technology didn't do a good enough job.
Yeah.
That's the commitment you're making when you come into this space. And a lot of vendors, to your point, don't understand that. And I'll let you comment as well too, Ricky, in just a second. The other thing I would, say is that this is a marriage. I'm not dating you. This is not a transactional relationship. You're going to know my dirty laundry. I'm going to know your dirty laundry. Some days you may be able to get a good deal out of us. The next day I may need you to discount this thing for me so we can get it in here. And then we might have a situation where it's COVID, right? And I need to defer a payment. Are you in this thing with me for the long haul, or are you in this just to get quarterly earnings? And if you're in it for just that, then you don't need to be in healthcare. Yeah. So I'll stop there and I'll let Ricky chime in, because I think also equally it's important for the vendor to have a strategic partnership with the provider, because as you are advancing your technology, as you're trying to understand what the challenges and demands are, it's important to get that customer feedback, that customer insights about your platform so that you can create the smart and right roadmap for it. And again, Ricky, I'll just let you chime in and give your thoughts as well.
Yeah. So like what you and Scott said about being a partnership and identifying the health system's needs, like Scott is an innovator. So if you're going to be a vendor with him, he's going to probably expect you to be a little bit nimble and flexible in your technology, because what he's wanting or what he's envisioning isn't necessarily a word. I guess it doesn't mean it has to be cookie cutter out of the box. It means it might take a little bit of flexibility on our engineers and really in our company's hands, and a good working relationship and a good trust built up between he and I think that whatever he needs, we're going to listen to it. We're not going to shove things down his throat. I think when I was selling to you at Centura, you had showed me like the app rationalization project, and it was like, it's clear that whatever executive was there before me just stacked a bunch of technology together with no cohesive plan. And I thought to myself, I'm sure those vendors were selling him in gray, but once that technology got implemented, they were nowhere to be found, because there is no strategic plan around all of this equity. So I thought in my career, I definitely want to be someone that is trusted. And when you call on me, that I'm going to deliver. And then, like you said, post-sale, I want to deliver on your strategy even after I've received that commission check.
Yeah, no, absolutely. And I think it's, again, to just drive the point home, it's a relationship, right? It's not just you're my customer, I'm your vendor. We have a relationship. I have your number. I can pick up the phone and say, here's a problem I'm dealing with. Any thoughts? Let's brainstorm on this a little bit. Many vendors that do this, you guys have solutions that do this. Here's the challenge I'm dealing with. And then vice versa, the vendor can say, hey, we've got this new thing we're thinking about investing in. What are your thoughts? Would you mind being on our advisory board or sitting down and learning more about this and looking at our roadmap? Does this make sense? So it should be really symbiotic in terms of how you operate. And there's mutual benefit in the long haul for each organization if they develop and cultivate that type of relationship.
Yeah, not to cut you off, but it's perfect with partnership. Is coming from the vendor side too. On the health system side, is a lot of the times like they are your sounding board and they're almost like your focus group on like whether it's positioning or whether it's product roadmap. But if you treat people right, they'll be the sounding board. They'll be the best support group. So yeah, it's just very important to keep a working relationship and a personal relationship.
And not only that, they can pick up the phone and call their counterparts and say, hey, take his call. Yeah. Take their call. When they call, I'm using them. You don't have to avoid, you have to put the vendor kryptonite up on this one. He's a good guy. So it can be a beautiful relationship if it's developed correctly. I do want to shift gears a little bit and talk about situations where, Scott, you've had a big challenge in the organization that you're trying to overcome. You talked about that a little bit in your introduction. And as you try to drive innovation in your organization, if you have one, if you don't, that's okay. If you have one, give me an example of sort of a big challenge you had around adopting technology or innovating something new in your organization and how you worked with a vendor partner to get over that hump.
Yeah, I think a really good example, because it ties in both the innovation side, it ties in the investment side, it ties in the partnership, and it ties in how you effectively onboard new technology. And then how do you effectively become the development partner, to your point, and driving the solution to its fullest and actually molding the solution to the actual problems that you have. And I love what you said earlier. We, in healthcare, and I'm sure it's in other industries, you have a lot of folks going out to conferences, going out to the marketplace and bringing you back solutions and and then saying, here's the solution. Let's try to find a problem so we can use this.
That's right.
And my pushback is you need to have a problem. And then once you have a clearly identified problem and you understand what capabilities you're looking for to solve that problem, then you can hunt for a solution.
Exactly.
So at my first health system, we were struggling with clinical communications, and we had the nurses had multiple devices. We had Cisco phones, we had pagers. The physicians had a completely different way to communicate with the organization. We had different on-call schedules. We had all kinds, and then we embarked in physician practice as well. And we just had a disaggregated, disconnected clinical communication problem. And it became a patient safety issue. And if, as a nurse, the worst thing for you and the thing that makes you feel most vulnerable is when you have a problem with a patient or a patient's going bad and you're trying to get a hold of physician because you can't do anything without a physician order. And you just feel that isolation and you're looking through a Rolodex or trying to find the on-call spreadsheet or all that nonsense.
Exactly. And it's 2:00 in the morning on a holiday.
Yeah. Oh, it was awful. Right. And as a clinician, I carried 4 pagers. It was madness. Right. And then I used my and I'm going to date myself here, but I had a flip phone that you couldn't really texting wasn't a thing.
Exactly.
So we really embarked on this, and partnering with the investment side, we actually invested in a company and became that development partner. And it was a 5+ year relationship in the development of this product, the adoption of it, and the replacing of products. And I look at that relationship, just how you described in the beginning, it really is like a marriage. You both invest in it, and the outcomes are tied together.
That's
and
right.
To your other point, if vendors don't understand that healthcare is different, then they have a problem. They should hire somebody from healthcare and figure it out, because
don't get in the game at all. Yeah, don't get in the game at all, because you're not going to be successful.
And you're right. We're dealing with patients, and there could be life or death outcomes. And then the other thing, from a business perspective, the margins are awful. If you were an investor, would you invest in a healthcare company?
Yeah.
Like a health system? No. Okay, hey, I want you to invest $150 million and you're going to get a 2% at best return. That's going to be no one would do that, right? And I think if a vendor understands that, they can partner. But yeah, so that's a great example, I think.
Sure.
And it was successful. Not only did we change and actually come up with the clinical communication and collaboration platform that's in the business now, we also were able to get rid of probably 10 different communication vehicles and skinny it down to one that was very reliable and people loved. And you could get a hold of any physician at any time.
Sure. Wonderful. Great case study. Ricky, I don't know if you were involved in that situation or not, but any thoughts or comments or even an example that you might have where you worked with an organization that was dealing with a challenge and you were able to help navigate them through to remediate that or resolve that issue?
I wasn't selling at the time. There was flip phones and pagers.
Wow, Ricky.
That's okay. That's all right. Yeah.
No, flip phones.
Yeah.
Pagers.
When I got in the game, there weren't even cell phones.
Yeah. Yes. But yes, actually, I think our latest product, it was born out of that. Somebody was like, hey, our call center is just like way too stressed out. We've tried everything when it's during the Great Resignation, and our solution to them. And we piloted it, and then it eventually became a product. Well, we're like, all right, what if we turn like the caller cell phone into like their, I guess, triage and their own call center? Meaning if they're trying to reach someone, they're really just trying to schedule, which most calls are. Take an inventory of call logs, just tell them to press 1 and send them that scheduling link. Then we call it digital call deflection, and just partnering just with something like that, the call volume was greatly reduced, and then they weren't dealing with the mass shortage in the call centers, and like the patient, the end user, their experience was much better. Instead of wait times, which we realized it pulled the numbers and people were abandoning at alarming rate. Right. So yeah, they call them instant access with their phone.
Wonderful. So talk to me a little bit, guys, about how do you move from dating to marrying in this relationship, vendor partner relationship? What are some steps or what are some things, Scott, that you noticed that Ricky was doing that gave you that feeling of confidence and that he was the right type of individual, first and foremost, and the company that I could trust and reach out to as a strategic partner as well?
Yeah, I guess my easy answer, and you're probably going to laugh at me, but you go into it carefully. So just like your example, you go into it carefully and you validate and you earn and gain trust. And I think that goes both ways. I think if I was giving advice to vendors, and Ricky and I've had this conversation with even stuff with him personally, you have to gain that trust, you have to be open, you have to be honest, and you have to be transparent. And sometimes that's to say, look, our solution is not right for you right now, or you're not ready for our solution, or you're not in an economic position for our solution. And I will keep in contact with you. If there's anything I can do for you, let me know. And when the time is right, let's re-engage the conversation.
Exactly.
And I think the other thing is you hear people go, I'm only going to deal with people that'll go at risk with me. And that's not realistic, but the strategy is, right? So if I feel that the vendor or my partner is tied to my success and their project plan is tied to speed to value and value realization. And if I don't get the value that they said, we're going to relook at it together and find that value. And I think that's how you earn that trust. And sometimes it's with different companies, but the same person, right? So Ricky and I have that relationship. And I think when he came to me with his new company, I was more open to sit down and listen and give my opinion on it and give my advice if he wanted it, but also I was willing to listen to it. So I don't think he's ever called my office phone at any of the places I've worked. I don't think I ever gave it.
I don't think you have an office phone number. I don't think you ever have an office phone number. But I will say, and one thing I noticed about Scott, he's very wary about vendors, because I met him at HIMSS events, and you as Christopher, everyone clamors from the CIOs, and he did a great job of being diplomatic, but just keeping people at an arm's distance. And I noticed that. So I was
I call it the vendor kryptonite.
Yeah. So that kind of lets you know hey man, this is going to be a long-term relationship. And the advice that I've gotten from our mutual friend introduced me, she's like, hey, make sure you're all in. So I could pick that up from the beginning, and that kind of just changes the way you view anyone. And it's more human, and it's not like, hey, he's a target that I'm going to go pick off at this event. And I'd like to connect with him and, of course, learn about him, and then have him take you up to a ski hill and possibly not.
That's right.
Yeah, just so you're clear, Christopher, Our mutual friend and I have a completely different story to that.
Sure.
So our perception of that, yeah, our memory of that is a little bit. That's okay.
He traversed that pretty well, didn't he?
Yeah, he said it real well. So I'm just
Yes.
going to let him keep this
Yeah,
one.
that sounds good. I think both of you said something I think is really important, and I hope those vendors who might be listening to this episode as well take this to heart. It starts with the individual, then the product, then the solution. If you don't have people in your organization are invested in this industry and invested in the mission of it, that's going to become transparent. Healthcare people can read you in a heartbeat and tell you, are you really in this game with us? Or are you just here for a quick, fast buck? If you're not in this game, I don't see you at HIMSS events. I don't see you participating in our annual golf tournament or whatever. I don't see you in the ecosystem, first of all.
Mm-hmm.
I only see you when you're ready to sell something. You're not invested in the industry. If I'm not seeing you provide support, services, advice, whatever it might be, it's a sponsorship, whatever it might be into the industry, then that's going to tell me you're not committed as well, too. And then obviously, as you get the opportunity to have an interaction with someone and they're only talking about just the product and the service and not about you and what's going on in your organization and really trying to build a relationship, because this is a relationship business at the end of the day. If they're not doing that, then why would I trust you? Why would I give you my cell phone number and tell you to call me versus give you my main number and go through my gatekeeper? And then you might get me or not. And so I think it's really important for those who are trying to be successful in this industry, and especially because these CIOs, guys, I'm telling you, they get no short of 20 calls plus a day, if not more, and tons of email crap that comes through that they don't have time to vet or read. And if it's not on that list of 10 things that are on that whiteboard in their office that say, these are my burning platforms, I don't have time to talk about it because I'm either spending a good part of my day putting out fires that I wasn't expecting when I walked in the door this morning. And right. And I've got all these other things I am expected to get done on time and on budget as well. Not to mention the tyranny of the urgent, which is what I call it. Well, doctors, nurses, administrators pop into your office and say, hey, I just heard about this new vendor that's got blah, blah, blah. Can you take a call with them? And now you're trying to figure out how to put that in your calendar as well. So it is very important that you understand the demands that are placed on these individuals and how you can help support them in meeting those demands, helping them solve the current problems that they're dealing with on an ongoing basis. As I expected, time is running out. I've got probably like 8 more questions I want to ask, so we may end up having to do a part 2 on this as well. But I really appreciate you guys' transparency and honesty and insights on this topic. And before we wrap up, I want to give each of you an opportunity I want to leave it on a sour note, but I want you to give me an opportunity where you had a bad experience with a vendor or a bad experience with a provider. And then any lessons learned from that experience or that journey. And I'll start with you, Ricky, this time.
So I guess bad experiences depends on how you take it. But
You don't have to mention names.
Yeah. What Scott was saying earlier is like when this partnership, you got to see it through post-sell, which is absolutely right. And I think when a vendor stops communicating with you post-sell because they have expectations, and if you're like at a company like ours, I feel like you get one strategic deal or academic health. You want to see that through because that becomes a marketing catalyst for things in the future. But I feel like a lot of the times that vendors aren't, and it could be on our part, we're not set up for success in the sense that, hey, when we outline an agreement, both sides had deliverables and we're delivering on ours. We can't enable you to be successful if you're not delivering on your part. And we understand people get busy, but often I'm like, didn't the executive, whoever's sponsoring that project, didn't they make time for this and their budget, not only financial budget, but their people allocation budget? And when stuff doesn't get off the ground, it's like they're pointing the finger back at us. And it's always a negative experience. Hey, we're hoping to do all these strategic things, not even just marketing for ourselves, but we wanted to make you successful. So we look good as well. and the deliverables on your part have failed. And now it looks bad. And now we spent a lot of money, you spent a lot of money and time, and it's all for nothing. So that's always like the sour patch when the organization, they don't come through on their deliverables, just like we're responsible for coming through on ours.
I think that's really important to point out as well, too, because sometimes when you're on the provider side, you don't always appreciate the fact that they have a business to run too, the vendor, right? They have a list of clients they're having scheduled to deliver services for. They have overhead and staff and resources that they have to try to maintain and manage and optimize as well. And when you don't meet those commitments, it can have a detrimental impact on the vendor's bottom line as well, too. So it's really important, to your point, Ricky, that you keep to those commitments you make. And if you're going to have roadblocks, hopefully you give folks enough of a heads up, because it happens, that people can regroup and reset expectations as well, versus deflecting and pointing the finger and saying somehow you were at fault. Scott, any thoughts on that as well?
Yeah, I have a good example. I will leave the names out, but I've had a strategy in my career to be cloud forward, to look to platformization. And yes, that's a word I made up.
I like that word.
I think I only get royalties for it. And then reduce complication in the organization. So those kind of 3 R's that IT professionals look at. So reduce complication, and ensure resiliency in your organization. And I tried to do that, and I ran into a situation, and you'll know who I'm talking about. But when you run Epic, you have only a couple options to get Epic to the clinicians. And this is right before COVID hit, and we entered into renegotiating our contract. And we've had this vendor for a long time, been a good partner, all of that. And we were dependent on this technology. And they came into our renewal with a 400% increase on price.
Oh my God.
And I'm like, fellas, I have 3% margin and you want a 400% increase? I cannot do that. I said, I get it must have came down from corporate. You have goals, or you didn't meet your goals the first quarter, and this now is a second quarter goal, whatever it is. I said, come back when you have a reasonable proposal. And so they pushed it out till we're getting ready to go past our contract if we didn't renew. And I was on their advisory board. So I called the VP of the West and I said, hey, you got to come out and help me. He came out and we sat down. He said, I got him to cut it in half. I'm like, cut it in half? That's still 200%. Come on, let's do this. So we were going to sign another 5-year deal. So this is a lot of money. And so in that sit down, I said, if you don't come back with a reasonable proposal, I'm not going to use your technology anymore. And they laughed and said, you have to use our technology. And I'm like, no, I don't.
No, I don't.
And so I signed a 1-year extension and went with a different vendor. And they were like, you're not going to do this. I'm like, no, I'm doing this. And we did it. But it's funny, that relationship carried over to here. We had to renew our contract here. And I utilized the same person that helped me out with that other problem to solve my problem here. And we cut through all the nonsense and got to a contract that was amenable to both of us. So I think that and from a healthcare perspective, you have to be strong like that. But sometimes you feel like you can't be, because you're beholden almost to these.
That's right. You can't hold me hostage to your technology.
And that's what it was. Like if they could have came back with something reasonable, and it would have never been a problem, right? But
that's just a 5-year contract. So I'm going to have a 5-year relationship with you, or you can recover if there was some revenue loss or something there. Over that 5-year period, I might be purchasing other services, other technologies, other solutions that can help the bottom line there. I'm sorry, Richard.
Scott, and on that, because so they feel like they had that price hike, this 400% is ridiculous. Do they do that because they felt like they had you in shackles anyway? Hey, you got to sign this anyway. It's so
exactly. They had cornered the market.
Yeah.
And they had every health system on the platform. Yeah. So they figured, like, why not? And you've seen this, Christopher, right? Like acquisitions of certain companies change the way those companies present themselves, and they become something that they weren't. And I think that's happening in our business all the time.
When a non-healthcare company acquires a healthcare company.
Yeah.
And they adopt their philosophy into healthcare, and it doesn't work that way.
Yeah, it really doesn't.
Yeah.
So that's the thing. It's like capitalism's great for the stuff you like want, but the stuff you need, like healthcare, it's not.
Yeah.
So like the outsiders coming in trying to capitalize on the market, but hey, our mission is to deliver health, and they're getting in the way with it.
Exactly.
Yeah, the funny thing about that, the rep lived in our area, and I'm like, dude, if you put us out of business, where are you going for your health care?
Exactly.
If you have to bring your grandma in, where are you going to take them?
That's right. That's a very good point. And you can be a conscientious capitalist as well, too.
Yeah. Oh, yeah. No, everybody's got to make money.
Good.
I'm not working here for free. They're paying me, right? Yeah. But I try to do my job, and I try to be respectful and responsible, right? And
absolutely. Gentlemen, unfortunately, again, I'm sure we could talk another hour or so about a host of different things related to this topic, but unfortunately, I do have to wind things down. I did want to just close out with kind of a list of best practices in this, and feel free to chime in on some of these as well if you have others around how do you CIO maximize this relationship, CIO and vendors maximize this relationship. And I have 4 points I want to just share with the listeners. The first one is to develop a clear technology roadmap. Hospital CIOs should work closely with their vendor partners to develop a clear roadmap that outlines the organization's technology needs and priorities over the next few years or so. This enables and ensures the organization is investing in technology that aligns with its long-term goals and objectives. The second is focus on interoperability. Interoperability is crucial in healthcare, and it ensures that different systems and applications can communicate with each other seamlessly. A hospital CIO should prioritize investing in technologies that are interoperable or open architecture platforms that integrate with the existing systems, as well as looking to technologies and building a platform that allows you to be able to integrate technologies that are not even here today in the future. Planning for that. Investing in training and education. Technology investments are only as valuable as the users who use it. How do you maximize that investment? Hospital CIOs should prioritize investing in training and education programs to ensure that staff members are comfortable and proficient in using new technology, and the vendors should make that training available. Should continue to create a model for ongoing training, because you're going to have turnover in any healthcare system. You're going to have advancements in the platforms, and you need to make sure you have a very healthy training program. And then monitoring and measuring for the ROI. Hospital CIOs should regularly monitor and measure the return on investment of their technologies. This helps them identify areas where they need to make adjustments or invest in additional resources that will ensure the organization is maximizing the value of those technologies. And the partners should be helping them figure out how to do that most effectively. I'll stop there and see if either one of you wanted to add anything else to that list as well, too.
Yeah, I wish I could disagree, because debating is fun, but I agree with everything you said. I think the one thing from an ROI perspective, you're right. If it's not a regulatory requirement, it's not a patient safety requirement, every new technology you introduce should have an ROI or should have a value. And if it doesn't, you're not going to last long as a CIO. And I think the other thing that I would note that you said that resonates with me is choosing the technology that aligns with your strategic plan. I think a CIO that doesn't do that is not going to be a CIO, at least for that company, very long, because you can, and you know this, Christopher, you can make a bad choice and it's really hard to live it down or get another chance. And it will follow you. And so you tread lightly or tread carefully. Those are great points, and I love them.
Wonderful. Wonderful. Ricky, any final thoughts?
My final thoughts for anyone coming up in business development is don't look at these healthcare executives as a vehicle to hit your quota. And I know so many young people do. And they're like, hey, if I can make this sell, this is what it's going to mean to me personally. Always look out for the health system's best interest. And like you said, prove an ROI. Make sure you prove an ROI, and make sure you have a plan around the technology and how they're going to use it, and how that executive is going to make their money back, because they're doing you a service by listening to you. So you should do the service by making sure you're well buttoned up and you have a great approach and prove an ROI to them.
Wonderful. I'm going to let you have the last word on that. And I want to thank both of you, Ricky Fletcher, Director of Strategic Partnerships with Luma Health, and Scott Raymond, Vice President and Chief Information and Innovation Officer at Nebraska Health, for your time and attention on this segment of Straight Outta Health IT. And as always, everyone who takes the time to listen in. Thank you so much for your support. If you like what was discussed here, don't keep it to yourself. Share it with your colleagues, your friends, your families, your pet, whatever you deem, what anyone you deem would think would get some value out of this. And as always, I appreciate your support. So until next time, take care, God bless, and see you on the other side.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.